The thing of this treatment program that I went into that was probably the most unique and probably is so necessary and useful for recovery is that it was, they focused on the milieu. So you're like going through this with 10, in this case, 10 other people are in this house together, all who have the diagnosis, and they're watching you all interact with each other. And if you put like 10 borderlines in a house together, there's going to probably be strife, and there was. And so they use that. They actually then like watch it, and you have to talk about it, and that gets used in conversation. And you have like, this person's pissing you off because of this, or you're then, avoiding them, or you're attacking them. So they actually start to take those things and say, wait, what's going on with so-and-so and you, and what's going on? And so you're actually having to negotiate those relationships in Vivo. And so we were being given an opportunity to basically learn how to relate to people by using each other as as live specimens, and then we're going out and getting jobs. I worked at a restaurant, and it was like a job in the service industry, which you can't fuck around in the service industry in terms of like how you interact with people. Like, it's all about treating people decently, because and so I would be like at a counter ringing people up, and if I'm a little not nice, I'm going to get talked to by the manager. You have multiple opportunities, which the world presents anyway, but where you have, these sort of tests you have to pass, where there's these mirrors that are put in front of you, and they're mirrors of life, because guess what? You're going to get fired if, you speak poorly to someone, or you do it consistently. So the great thing about the program that I was in was like they're really working to get you back into the world if you've into the world for the first time if you've never been there, or back into the world if you were and you sort of lost that capacity.